On January 28th, 2017, Serena Williams, the greatest athlete of my lifetime, delighted fans by winning a record-breaking 23rd Grand Slam title at the Australian Open without dropping a single set. Fans were later stunned to find out that she accomplished this miraculous feat while she was 3 months pregnant. Serena Williams, arguably in better shape than most pregnant women alive, later detailed her experience with serious, potentially deadly complications shortly after her C-section birth with her daughter. Williams explained that the day after the birth, she started feeling short of breath. Due to her personal medical history of having had pulmonary embolisms, Serena knew exactly what she was feeling, and she knew exactly what needed to be done. But when she alerted the nursing staff, initially, she was not taken seriously, and it was only after much prompting that they finally listened to her. A CT scan was ordered, and she was put on a blood thinner that would save her life. What happened to Serena Williams filled the hearts of many Black women with dread. It illustrates just how hard it is for Black women at all levels of society, even wealthy, elite athletes, to be listened to by the medical professionals who are entrusted with their care. Williams' account places her among the nearly 50,000 American women, twice as large as the capacity of Arthur Ashe Stadium, who deal with dangerous or life-threatening pregnancy-related complications every single year. Black women, like Serena Williams, are more likely to face these complications and to be part of America's ongoing maternal health care crisis. So our clinical scholars team is called Maternal Health Matters because it does. And we have focused our energies over the last few years on making sure that the voices of Black moms are heard and elevated. We know that the United States has the highest rate of maternal deaths among all industrialized nations, nearly 3 times as many as our counterparts. And those rates have been increasing over the past decade. But even more shocking is that 60% of those deaths are preventable if only those women had better access to quality prenatal and postpartum care and help with management of their chronic conditions. In New York City, where our work is based, Black women have the highest maternal mortality rate at 51 deaths per 100,000 live births. That is nearly 3 times that of Latina and Asian women and 8 times that of white women. These differences are even more pronounced among women who are living in the lowest income zip codes in New York City. The question is, why is this happening? 3 reasons stand out. 1, pre-existing chronic illness. Black women are more likely to have gestational diabetes and hypertension, and that puts them at risk for poorer outcomes. And their preeclampsia rates are 60% higher than white women. 2, chronic stress. Research has shown time and again that Black women are under more psychological and physical stress than women of other races. That stress can lead to a variety of poor outcomes that affects their overall health. 3, the racial bias and discrimination of some healthcare providers towards Black women leads them to not hear or value the concerns and complaints of Black women in the pre- and postpartum periods. So our team's goal was simple. We take our combined expertise as moms, as healthcare professionals, and as women to try to understand the lived context that prenatal and postpartum women were facing in New York City. We want to translate those findings into education for healthcare providers and the community at large. And we want to provide support systems for women during their pregnancy and postpartum periods via digital health-based solutions, and use the information that we gathered during our interviews to build the foundation for a maternal health coaching program. So what did we hear from women when we took the time to listen? We learned that COVID-19 significantly impacted their mental health, the viability of their social support systems, their ability to find and keep employment, and the overall quality of their prenatal and postpartum care experience. Women complained about the lack of consistency and continuity in their care. They described not knowing about community and clinic-based resources that could help them. And most of all, they lacked access to insurance, benefits, childcare, and transportation. I want to share some of the other challenges these women reported. Women described feeling overwhelmed, scared, tired, and lonely. They didn't feel comfortable talking to their providers about their concerns, and they didn't get the answers they needed in a timely fashion when they did. Women who are immigrants reported being treated differently and not having their concerns adequately met. Overall, there was a sense that women were not being heard in their prenatal and postpartum experiences, and many were so grateful for the opportunity to speak to us and to share their stories. But listen, this problem is so large that it is going to take all of us, the entire village, to help solve it. In my current role as Vice President of Clinical Operations at OneDrop, we are partnering with the New York City Department of Health to offer tailored, culturally appropriate health coaching and educational resources to women who are diagnosed with gestational diabetes. Our health coaches are working with these women in their prenatal and postpartum stages to ensure healthy pregnancies, deliveries, and beyond. Women enrolled in our pilot program also receive medical devices for at-home blood glucose and blood pressure monitoring at no cost to them. So I want to share some of our success. Our first baby from the pilot was born in July of 2021. He was healthy, full term, and successfully breastfed. Also, through our program, a number of women are no longer considered high risk due to their successful blood sugar and blood pressure management. So what are some of the things that you can do right now to address this issue? We encourage you to support legislation that addresses maternal health issues, including those specific to COVID-19. As we all know, COVID served to worsen the pre-existing inequities we already had in our society, including disparities in maternal health outcomes. In the future, we want every birthing person to have a safe, healthy, happy delivery that is uncomplicated by racial and income inequalities. But to help achieve this, we need to spread the word on social media about how we can change the policies around maternal health. We need to join community-based organizations that are leading critical maternal health initiatives in the cities and states where you live. Also, please support initiatives that allow for guaranteed postpartum health visits and paid leave to mothers after they give birth. Lastly, I encourage you to support solutions that hold healthcare practices accountable for not adequately caring for Black women. One such solution is coming from Kimberly Seals Allers, who created an app called Earth, the name of which is inspired by the word birth, but without the B for bias. This app allows Black and brown birthing people to share their experiences with doctors and medical providers so that others can find places where they will also receive good quality prenatal and postpartum care that is without bias. Others, including myself, are reclaiming the narrative around Black birth and highlighting that joyful Black birthing stories do exist and they can multiply exponentially in the future. One podcast, also by Kimberly Seals Allers, that is doing this is called Birthright. And it is based on the notion that we can learn as much from Black triumph as we can from Black pain. And these are important lessons to be learned. In conclusion, I want to live in an America where maternal health disparities do not exist. Many of us believe that this future is possible, but only if we create equitable healthcare experiences and solutions. So please join me in taking action to address systemic racism and gender inequality. Let's use our most powerful tools, our voices, our minds, and each other to build Black women up and foster anti-racism in healthcare. Together, we can.